Welcome to Anatomy DAHAR series. Today's topic is pectoral and pelvic girdles, diagram-based undergraduate teaching programs. It includes practice questions at the end. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Pectoral and pelvic girdles. Pectoral comes from the Latin word pectoralis, which is pertaining to the breast or chest. Pelvic, pertaining to the pelvis, which derived from pylos, means the lower portions of the trunk of the body in Latin and Greek. What is girdle? It is the belt or encircling structure of the body. Components of the skeleton of the body. The skeletons of the body consist of two main components, the axial skeleton and the appendicular skeleton. The axial skeleton includes bones of the skull, vertebral column, and the rib cage, including the sternum. They are in yellow color in the diagram. The appendicular skeleton includes bones of the upper and the lower limbs. They are light blue colored bones in the diagram. Look at the diagram first. This is the skeleton. The yellow colored bones are bones of the axial skeleton. The light blue colored bones are bones of the appendicular system. This is girdle, pectoral girdle and pelvic girdle. They are light orange in color. Functions of the girdle. Bones of the girdle connect the appendicular skeleton to the axial skeleton. The appendicular skeleton of each upper limb is connected by respective pectoral girdles to the axial skeleton. The appendicular skeleton of each lower limb is connected by respective pelvic girdle to the axial skeleton. The girdles are in orange, light orange color bones in the diagram. They transmit thrust between the appendicular and axial skeletons. In appendicular skeleton, each upper or the lower limb has 30 bones, that is not including the bones of the respective girdle. In general, the adults have about 126 bones in appendicular skeleton. In axial skeleton, the adults have about 80 bones. Average total of about 206 bones in adult skeleton. Pectoral girdles. Let's see the diagram first. As I have mentioned earlier, yellow in color bones are bones of the axial skeleton. Bones of the girdles are in light orange in color. Let's talk about the pectoral girdles. In the diagram, if you see, this is the sternum situated in front. There are a pair of pectoral girdles, right and left. Each is made up of two bones, clavicle in front and scapula behind. Clavicle in front and scapula behind. The clavicle has a direct contact with the manubrium sternum in front, that is the bone of the axial skeleton. However, the scapula, which are situated behind, does not have a direct contact with any bones of the axial skeleton. Please see more detail about the clavicle and the scapula in Anatomy DAHAR series. Movements of the pectoral girdle. In this slide, we have two diagrams, diagram A and diagram B. Diagram A is right pectoral girdle seen from in front. You can see here, this is the clavicle, and this is the scapula, and this is upper end of the humerus. And behind and above that one, this is the clavicle, and this is the scapula. This is the pectoral girdle is at lowered position. This is after raising at the higher position. So this is lowered, this is higher positions. Next is in diagram B, we are looking the same right pectoral girdle from above. Here is the clavicle and here is the scapula. It is moved forward, that is protraction, and this light red color, clavicle and scapula, it is moved backwards, retraction position. The shoulder, that is glenohumeral joint, is the most freely and widely movable synovial joint in the body. It is between the head of the humerus and glenoid cavity, that is glenoid fossa of the pectoral girdle. In the short range of movements of the shoulder joint, such as flexion, extension, abduction, adduction, rotation, and circumduction, the movement is limited only at the joint. However, in wider range of movements, such as raising and lowering, and protraction and retractions of the shoulder, various movements of the pectoral girdle accompanied. See diagram A and B. In diagram A, you can see pectoral girdle, right pectoral girdle is lowered position, and the same pectoral girdle is raised up, that higher position is there. That is up and down movement. Again, if you see the diagram B, you can see this pectoral girdle is moved forward, that is protraction, and pectoral girdle is moved backwards, there is retraction movements there. So in wider movements of the shoulder joint, the pectoral girdle accompany to achieve a wider range of movements. The appendicular skeleton of the lower limbs, these are the ones which are light blue in color, are connected to the axial skeleton, which is yellow in color, by respective pelvic girdle, which are light orange in color. A pair of pelvic girdle, right and left, each is an innominate bone. Each innominate bone is made up of three bones. Number one, pubis, which is below and in front. Number two, ischium, which is below and behind. Number three, ilium, above. They fuse together into an innominate bone, also called hip bone. So each innominate bone is a pelvic girdle of each side. We have two diagrams here. One is seen from in front, anterior view. One is seen from above, superior view. If we follow the color code, this light blue in color is the appendicular skeleton. This is the bones of the lower limb. Yellow color is the axial skeleton. This is the sacrum. And here on either side is the pelvic girdle. We will see Each is the innominate bone, and just now I mentioned each innominate bone is the pelvic girdle. In the previous slide, I mentioned it. If we see this diagram, two innominate bone, that is each is pelvic girdle, one on each side, joined together in front, ventrally at the symphysis pubis. If you see this diagram, each innominate bone, that is each pelvic girdle, joined posteriorly or dorsally to the side of the sacrum at the sacroiliac articulation here. Three of them, that is sacrum behind and each innominate bone or pelvic girdle in front, all three of them join together and form a ring of the skeleton called pelvis. As we know, in pectoral girdles accompany to achieve a wider range of movements at the shoulder joint. However, in the case of pelvic girdles, the pelvic girdles are fixed and have very limited movements only. Fine points, structural divergences in pectoral and pelvic girdles. These fine points can be skipped over by undergraduate students. We have two columns here, pectoral girdle and pelvic girdle. Pectoral girdle consists of two components, clavicle and scapula, which remain separate. Pelvic girdle consists of three components, pubis, ischium and ilium, which fuse into a single bone called innominate bones or hip bones. Pectoral girdle has no articulation with vertebral column. Pelvic girdle has articulation with the sacral vertebra posteriorly. Pectoral girdle has no direct ventral, that is anterior articulation of two sides. Pelvic girdle has direct ventral, that is anterior articulation of two sides at symphysis pubis. Pectoral girdle articulation with the axial skeleton, that is clavicle to the sternum, is relatively small and mobile. Pelvic girdle articulations of innominate with axial skeleton, that is sacrum, is relatively large and limited movements. Pectoral girdle is lightly built for mobility. Pelvic girdle is massively constructed for resistance to stress. Pectoral girdle is resilient to thrust, and pelvic girdle transmit thrust between vertebral column and leg. Pectoral girdle ossifications of clavicle is dermal, that is intramembranous and endochondral. Scapula is entirely endochondral. In pelvic girdle, ossification is entirely endochondral. Both girdles articulate with the first segment of the bone of the limb by ball and socket joint. Practice questions. What do you understand the followings? Pectoral, pelvic, girdle. How many components are there in the skeleton of the body? What are they? What bones are included in each component? How many bones are there in each limb? And the axial skeleton in adult. What is the function of girdle? What are the bones of each girdle? What is the pelvic girdle and pelvis? How do the axial skeleton articulates with the first segment of the bone of the limb? What are the structural divergences in pectoral and pelvic girdles? Optional. The end. Please subscribe and click alerts to get updates for our new videos. Please see related topics, the clavicle, the scapula, under Anatomy DAHAR series. Illustrated, prepared and presented by Dr. Abdul Hamid Abdul Rashid. Thank you.